part of measures to curb the deadly coronavirus, the Yobe state government has officially announced the closure of state's boundaries and directed tricycle operators not to convey more than 2 passengers at a time. The directives were issued after the inspection of the state isolation center and procured equipment specialist hospital. Michael Oshoma has details in this report.
This rapid spread of the coronavirus within Nigeria is a source of worry to states yet to record a single case. It has prompted many state governments to partially lock down the states, restricting movement and in some cases even locking down all entry points. Yobe state government is now taking some decisive measures to keep its citizens safe.
In our own case, it's the first of this experience in our life. We don't know of those 70 and above years who never have witnessed such kind of disaster, but for our own generations of 65 downward, I think is the worst period where we were experiencing this kind of disease globally. Even the superpowers are trying to put us off, and the developed countries as we are. So the only thing is, humanly we do our best and seek for Allah's intervention. In view of this excellency, as directed composition of the foreign committees, to ensure that humanly we do our best to curtail this virus from our state, what we will.
All workers in the employ of the Yobe state government from level 12 downward should work from home, except workers in the water supply and sanitation sector, healthcare sector, state emergency management agency, and fire service. Those are essential services that should continue to report to work. All other workers from level 12 down should work from home.
The State Ministry of Health has been mandated by His Excellency Honorable Balabuni to remain proactive and take all measures to prepare just in case. We are not praying and we don't hope that it will happen, but then just in case it does, we have also put in some preparedness measures. We are intensifying training of our healthcare workers and identifying specific healthcare workers that will manage cases should it arise. We have also pre-positioned personal protective equipment, hygiene kits and other things around, and we are also mobilizing for resources for additional ones from our partners and from other well-wishers around. We've also identified and we have isolation centers here in Damaturu. The central isolation center is located in the premises of the state university, the Yobe State Specialist Hospital. And then, of course, we have some satellite ones that will temporarily harbor those that before they are tested. So we have ones in Nguru, and then we have one in the University Teaching Hospital. We are very much aware of the consequences, and we are very much aware of the protocols that need to be followed, and we are doing what it can, and of course we are continuously obtaining advice and recommendations from the experts.
As part of measures to support the state government, the Nigerian Service of the Civil Defense Corps also took to the markets, motor parks and social places to sensitize residents on the danger the virus poses.
The thing I'm doing in Damaturu Township here is being done in all the 17 local governments across the Yobe State, because we have replicated the same committee that I set up. There are 250 men in this committee. Most of them are paramedics. They are of the medical unit of the disaster and crisis management. So you see them all are here. So apart from the fact that we create enlightenment, we are going to create a stand in all these public places to ensure that people observe the sanitary precautions. So on Sunday, we'll be in the churches. Today, when you go to the Central Mosque now, you see us and some other mosques around the town.
The NSCDC Yobe commandant noted that worship centers who do not comply with government directives would be dealt with accordingly.
In Damaturu and even the Central Mosque, you see our officers stand by. So on Sunday, we make sure that services are conducted within the limit that the government has set.
Even though Yobe State hasn't recorded any case relating to coronavirus, residents and stakeholders are calling on the state government to impose a shutdown directive on markets, social gatherings, and worship centers across the states.
We can't close churches alone. We still have mosques and the rest. So, and that is why, as a body, we are under a constituted government here. So we need to hear pronouncement from them. If all bans are put on this, then we'll follow suit.
Residents are taken seriously to observing personal hygiene in order to avert contracting the deadly coronavirus. Government is also playing its role by procuring equipment in readiness in case its states record a positive case. Governor Maimala Buni and other top government dignitaries visited the isolation center that has been set up to see for himself the level of preparedness.
I'm impressed with the precautionary measures of adopting, and alhamdulillah, Yobe State here, we don't have a single reported case of COVID-19.
The governor's aides explain why there is now need to take more restrictive measures.
The Yobe State government has already announced the closure of the state's borders with neighboring states and with neighboring Niger Republic from Tuesday, 31st March 2020 from 12 midnight. The committee resolves that henceforth, commercial tricycle operators are only to carry a maximum of 2 passengers at a time, while commercial vehicles will carry a maximum of 4 people, including the driver.
This is just a temporary measure that we feel will help with the social distancing aspect that we'll be emphasizing. Because we ask people to maintain social distancing in their normal social meals, and then when they travel in a commercial car, they are crowded in a car. I don't think that social distancing has been observed as well as it should.
Markets, religious and social gatherings are still to remain open as the government does not want to escalate the hardship residents are already confronted with because of the insurgency.
Prayer remains the important weapon against any known and unknown pandemic. Like you all know, Yobe State, we are fighting 2 battles. We are fighting the insurgency and at the same time fighting the coronavirus pandemic. We should be steadfast in our prayers. Allah subhanahu wa ta'ala will inshallah protect us. We are happy that we don't have single reported case in Yobe State, and we should try to remain safe and prayerful.
The Yobe State government appreciates the people of the state for their steadfast compliance with the recommendations earlier made by the committee. The state government recognizes that such compliance is absolutely necessary in ensuring that the state remains free from the coronavirus disease.
All these measures are observed for an initial period of 2 weeks, but this period is subject to review by the committee, and upon review, the committee will look at what is best for the state, what is best for the people, and will adopt that measure going forward. So for now, the borders of the state are closed for an initial period of 2 weeks, but before the expiration of the 2 weeks period, we'll look at the measures, how effective they are, and whether additional measures are needed. So, you know, this is a moving target. You know, normally the disease itself, the virus itself, will lead the way, right? It depends on how it happens. You know, so nobody can say anything as to what is definite. But for now, we continue to take the measures that are necessary and that are appropriate to ensure that we keep an outbreak from taking root here in Yobe State, to ensure that all the people of the state are safe.
As part of the presidential directive that all NYSC camps nationwide be converted to isolation centers, Yobe State government has complied with the directive by upgrading the facilities to the required standard. Governor Buni, who was represented by his deputy, paid a supervisory visit to ascertain the true condition of the facilities.
One has directed that all NYSC camps should be free to the COVID-19 in their respective states in case of intensity for isolation camp. And His Excellency, the Deputy Governor of Yobe State, Honorable Malabuni, is keenly following of what's happening globally and mostly in Nigeria. That's why he directed this committee, COVID-19, to come and see the camp and make the necessary arrangements in case of eventualities. Though the state has not recorded any outbreak of COVID-19, but notwithstanding seeing what is happening globally, we should be ready for any eventualities. That is why the COVID-19 with all its members who are here to see the site, and we really appreciate what we have seen in ground, because this camp can, I'm going to tell, as much as 3,000 patients if need be, though we are not praying for even single one. And then we appreciate the efforts of the coordinator NYSC Yobe State, which has directed some of our NYSC members have volunteered to ensure they give the support to this COVID-19 committee to ensure that Yobe State is free from this virus.
Has guidelines for the establishment of isolation centers, and will apply those guidelines to modify the camp to suit to fit into an isolation center. So all the facilities that are needed, the restructuring and everything will be done in order to ensure in case that is required.
One suspected case of COVID-19 has been identified in the cosmopolitan city of Potiskum in Yobe State. The State Health Commissioner briefed journalists on the state of symptoms exhibited by the suspected patient.
A 30-year-old truck driver presented to the General Outpatient Department of General Hospital Potiskum on the 2nd of April 2020 with symptoms of cough, fever and difficulty in breathing of 6 days duration. The patient had traveled to Lagos 7 days earlier. He left Lagos on the 23rd of March 2020, but had to stop over at a primary healthcare center in Bauchi on account of the above symptoms when he couldn't continue his journey to Potiskum. He neither could remember the name of the facility nor the medications he was given. He left Bauchi and arrived Potiskum on the 1st of April 2020. According to his colleagues, he had not gone to his house, neither to his neighborhood. So he had no contact with with his family or members of his neighborhood.
He also stated the next step taken to ascertain the true position of the suspected COVID-19 patients.
The issue is that while the person presented with those symptoms and has also met the case definition, but then there is this likelihood that he may have other problems that or other respiratory infections that are not COVID-19. So we cannot certainly say that this is the problem unless the results are out. So as it is, he's being investigated for 1, respiratory tract infection, 2, for tuberculosis, and then 3, for coronavirus disease. Nasopharyngeal and oropharyngeal swab was collected at the facility, and this was transported to the Nigerian Center for Disease Control and WHO accredited lab in Abuja.
The Yobe State Commissioner for Health called on Yobe State citizens not to panic as the situation is under control.
Welcome to the interview segment on Impact Yobe. Our guest today is the Honorable Commissioner for Health in Yobe State, Dr. Mohammed Lawan Ghana. Welcome to the program, sir.
Thank you very much.
Sir, this sector, the health sector, is one very critical sector to the growth and development of Yobe State. And His Excellency, Governor Malabuni, has also given you a marching order, a mandate. Let's talk about these mandates now and how well have you been able to achieve it so far.
Okay, thank you very much for me. As you have rightly said, the healthcare sector is a very critical sector, and it's one of the priority sectors of His Excellency, the Governor of Yobe State, Honorable Mebala Muni. When he came into power during his inaugural speech, he has clearly
set out his agenda as with regards to the healthcare sector. One of them, of course, is the achievement of universal health coverage, and that is going to happen through firstly ensuring that in each of the wards of the state there will be one functional standard primary healthcare center per ward. The other thing is also to ensure that in each of the local government headquarters there is a general hospital. This is not only in terms of providing the infrastructure, but that is why the word functional and standard came about. That means that it is also backed with the necessary human resource for health, the equipment, the medicaments, the supplies, as well as a system of financing the healthcare. Part of the things, of course, that have been done is the establishment of two very critical agencies. That is the Drug and Medical Consumables Management Agency, which is the agency that is vested with the responsibility of ensuring the availability of high quality drugs, medical lab reagents, and other consumables across the facilities, as well as the Yobe Contributory Healthcare Management Agency, which is the agency that is vested with healthcare financing across the state, both in terms of providing healthcare coverage for the people, as well as, of course, financing healthcare for the facilities. There are also other achievements in terms of human resource for health. He has looked at human resource for health in both in the short, the medium, and of course the long term. In the short term, the state government has actually lifted embargo on the employment of health workers. So, of course, there are employment of doctors, additional absorption of all nurses and midwives that have graduated from the college, in the indigenous ones. And then, of course, also employment of those from coming from, of course, outside to bridge those gaps. We've also used mechanisms and other models to see how we can also assist the government through partners and other funding streams. The other thing is, of course, he clearly, of course, understands the fact that without producing those human resources internally, we will not be able to achieve the desired number and level that we want to get to. So His Excellency made it prioritized, ensuring that the schools, that the production schools that produce the human resource for health are also looked at. For instance, for the College of Nursing and Midwifery here in Damaturu, you will see that there are additional hostel accommodation, and then, of course, so many issues around accreditation requirements for each of the programs. As it is, we have rolled out additional programs such as the community midwifery, the midwifery program, and then, of course, enhancing the nursing aspect. Of course, again, looking at the primary healthcare sector, there is a College of Health Sciences in Guru, which again has started rolling out additional programs. With the coming of His Excellency, he has also further enhanced and strengthened their capacity to be able to run and manage such programs. Again, he has also further enhanced, that there is a medical school for the production of doctors. As it is now, the first batch are in their second year. And then, of course, everything is being done to ensure that they seamlessly transit to the clinical site, get accreditation and other issues. But then, as it is, of course, we already have the provisional needs to be able to start the program. So, as you can see, His Excellency, what he has done is look at the health system in its comprehensive manner. And then for each of the building blocks, there are interventions that are addressing such blocks.
These progress reports you have just reeled out, would be of no impact if the people cannot access it. How accessible is healthcare delivery in Yobe State with all of these that the governor has put in place?
Yeah, thank you very much. You see, it is based on that understanding that right from the outset, Yobe State, the healthcare system was designed in such a way that it is accessible to the people. Since 2010, the state has operated a free drugs program for pregnant women, children less than 5 years, and accident victims. And the program is still on. But in view of to ensure and then to further up the package and then ensure that access is granted, the state, that is why we quickly keyed into the Drugs and Medical Consumables Agency to ensure access to, because when a person leaves home, comes to a health facility, obviously getting the prescription, they need to access the medications, because that is it. Without medications, of course, there will be no facility. So that is one way. The other thing is that we know that one of the barriers to access to healthcare services is the issue of finance. So looking at that, and then of course knowing that Yobe State is a state that is predominantly rural, and then of course the poverty, people, the purchasing power is not as high as places like Lagos, Akano, or others. So it is in that light that the government, as soon as His Excellency got wind of the fact that there is a scheme that will be able to alleviate these sufferings, he quickly keyed into it. And that culminated into the establishment of the Contributory Healthcare Management Agency. And the design of the agency is like looking at all the programs, not only just one. So we're also looking at the formal sector, but then side by side, as a priority, the informal sector is also going to be rolled out so that everybody will be able to have access to healthcare without suffering financial hardship. Now, another problem is, of course, geographical access. Yobe State has very difficult terrain. Any definition of difficult terrain exists in Yobe State. So part of the things that we do is, as we have said, taking the healthcare service as close to the people as possible. That was the intention of bringing forth the keying into the policy of one functional standard primary healthcare center per ward. But then again, wards that are far from, settlements that are far from the ward, we've also designed programs around, we do a lot of outreaches, and then of course we have mobile. The outreaches are in the form of either mobile outreaches or just outreach around that. And then we've also have also done an initiative where we customized what we call the customized tricycle ambulances to take care of those rural hard to reach communities where there are no vehicles. So we have these tricycle ambulances that we are recently going to roll out after His Excellency graciously approved for the rollout of that scheme. So with that, at least we can, fairly address the issue of geographical access, because basically it's to ensure that any person in the farthest distance, however difficult it is, will be able to get to a healthcare facility, or the healthcare can reach that individual. But then the most important thing that we're working towards is to ensure that there are healthcare structures where people can come and access services. And this is what His Excellency has charged us to do.
What's that picture of the healthcare sector that Governor Mai Mala Buni has, and has told you people to try to ensure that that comes to fruition?
The picture basically is the global requirement of achieving universal health coverage. Every citizen of Yobe, no matter where they are, they should be covered with healthcare services. That is the number one vision which we are working towards, which of course in the last few minutes that we've been trying to describe, looking at the entire health system pillars. The other thing is also our desire, and of course it's something that we're also working assiduously to achieve, is to make Yobe State a hub for medical tourism. Give people the option of coming to Yobe State to access healthcare service, which ordinarily they will have to travel abroad. The thing is that it has not only healthcare implications, but then also it has also economic and tourism implications for the state. As it is, of course, you've come to the state, you've seen how free the state is, and how the changes that are happening is all in a view to actually look at, pose the state towards getting to that level. The other thing obviously is also positioning the state to also produce enough human resource for health
not only for the need of the state alone, but again, of course, even exporting human resource for health. So the system basically is looking at all these novel approaches towards a very strong healthcare system that can stand the test of time and that can compete with anywhere, any place, any person can go to.
Thank you very much, sir. Well, there you have it, the Commissioner for Health in Yobe State, reeling out the achievements, plans, programs and policies of the administration of Governor Mai Mala Buni towards repositioning the health sector to further provide quality service to the people of the state. Thank you very much, Honorable Commissioner, for your time.
Thank you very much,
and I wish you all the
Pleasure.
best. Thank you, sir.